Welcome, hero. Your journey to become a radiographer has been quite a challenge, yes, this I know. But your dedication has been admirable, and I toast to your achievements. Yet, another river lies in your path that must be crossed. There are no surprises here. You have been training for this quest for many moons. You may have even given your own speech on this very same subject, so think of this not as a river. Consider it a stream. Nay, a babbling brook, if you will. Yes, yes, a babbling brook of contrast media awaits, dear hero. Onward!
Yes. Contrast media. The use of contrast media enhances the visibility of radiographic images by helping to distinguish between different tissues and aid in diagnosis. There are many different routes of administration and types of contrast media, all of which are exam dependent. Look to our friend in the stars for more information. Remember, hero, a friend is always around the corner.
Contrast media is used in medical imaging, like X-rays and CT scans. Contrast media's pharmacodynamics causes the contrast of the area being examined to be altered, increasing its visibility amongst surrounding tissue. Elements like barium and iodine are chosen due to their high atomic number, causing absorption of X-rays better than surrounding tissues, appearing white or light gray on images. This helps radiologists identify tissues and detect abnormalities, like blockages or tumors. Contrast media selection depends on the diagnostic procedure and the patient's condition. Contrast media is considered a drug because it can have pharmacological effects, interactions with other medications, and potential side effects. But more on that later. Bye-bye.
Hiya, score extra points by answering this question correctly. What is the primary purpose of contrast media in medical imaging? Is it to decrease radiation exposure, to enhance patient comfort, to improve the clarity of the image by differentiating tissues, or to reduce the cost of medical imaging procedures?
Contrast media can be divided into two main categories. The first, positive. These have a high atomic number and photons are absorbed. On an X-ray image they appear light. Examples include barium sulfate, ionic iodine, and non-ionic iodine. The second category, negative. These have a low atomic number and photons are scattered, not absorbed. On an X-ray image they appear dark. Examples include gas or air, gas-producing tablets or crystals, and carbon dioxide. A common barium sulfate contrast used is EZHD. Its high viscosity allows it to adhere well to the mucosal surfaces and provide visualization of structures in the GI tract. Administered orally or rectally, it is usually well tolerated. However, history of GI perforation is a contraindication to use. Omnipac is a non-ionic iodinated contrast medium commonly used in CT, angiography, and myelography. It is administered in many ways, including intravascularly and intrathecally. Indications for use include enhanced imaging of vascular structures and the central nervous system. Patients with pre-existing conditions such as severe renal insufficiency, diabetes, or dehydration are at higher risk for contrast-induced nephropathy. Additionally, caution is advised for patients taking nephrotoxic medications. As with any exam, informed consent should be obtained. Forgive me while I expand a bit more on Omnipaque. It is distributed throughout the extracellular fluid space. It is not metabolized by the body and is primarily eliminated through the kidneys via glomerular filtration.
Hello again. Score extra points by answering this question correctly. What is a common type of contrast medium used for myelograms? Is it non-ionic iodine-based contrast, barium sulfate, gadolinium, or air?
Welcome to the Cave of Adverse Effects, Hero. In this cave, you will find 3 different paths you must follow. Each subsequent path contains reactions more dire than the previous. The level of difficulty must not faze you, for this quest shall prepare you for the uncertainties you must face in your future endeavors. Before you begin, you must remember all 3 paths have the same basic principles that must be followed at all times. First, patient safety comes before all else. Watch for reactions closely and monitor vitals consistently. Second, complete a thorough history with the patient before any exam. Last, know the location of emergency equipment, such as the crash cart, and always ask for assistance if needed. Remember, Hero, a friend is always around the corner. Please choose your path. Mild reactions to contrast media may include nausea or vomiting, dizziness, headache, anxiety, swelling, hives or general itchy sensation. However mild the reaction may appear, always remain alert to ensure symptoms do not progress. Administer an antihistamine, such as Benadryl, for symptomatic relief. As these symptoms are typically self-limiting, providing reassurance to your patient can go a long way. Please choose your path. Symptoms of a moderate reaction may include facial swelling, throat tightness, wheezing, and isolated chest pains. If your patient presents signs of a moderate reaction, recall this information to help ease their suffering. If an allergy to the contrast media is suspected, administer diphenhydramine, or more commonly known by its trade name of Benadryl. Provide an oxygen mask if needed. Use an albuterol inhaler to ease wheezing or throat tightness. And Hero, always request assistance if needed. Please choose your path. Severe reactions to contrast media may include arrhythmia, hypertensive emergency, laryngeal edema, or bronchospasm with significant hypoxia, treatment-resistant vasovagal reaction, convulsions or seizures, and anaphylactic shock. Now, Hero, it is imperative that you listen carefully, for this is a matter of life or death. If you encounter any of these reactions, you must remain calm and apply this knowledge based on the situation presented before you. Always request help immediately. Administer epinephrine for anaphylaxis. For bronchospasm, use an albuterol inhaler. Provide high-flow oxygen to combat hypoxia. And for severe vasovagal reactions, administer atropine.
Hi there! Last chance for bonus points. If your patient is experiencing anaphylactic shock, what should be administered? Benadryl, oxygen, ginger ale, or epinephrine?
Congratulations. You have completed your contrast media journey. Remember, hero, a friend is always around the corner.